Beautiful Saturday afternoon. We're going to be having the COVID-19 Task Force daily update coming to you in just a matter of about 45 seconds or so. We have 3 speakers today and doing something a little different today, coming to you from the site of the test site that will be opening up tomorrow, and we'll speak to the people you need to speak to. There will be some road work done, so we'll talk about that. So just to give you time to get set up to as we're about to start this show in just a matter of a few moments, and we should be good to go. All right. Wakanuradu, and welcome to today's COVID-19 Task Force live update. I'm Joe Delarone. Today is Saturday, March 28th, and today we're coming to you from outside the task force, the test site that's going to be opening tomorrow. That's pretty big news, and what that means is, to start things off, there will be some changes to the traffic patterns around the Kahnawake Memorial Hospital Center. Joining us to describe that briefly is Ajeza Foot, the coordinator of the emergency center. And Ajeza, what can you tell us about what's going to be happening with the roads here in this area?
Well, presently we started around 9 o'clock this morning setting up the site. There will be a closure and restricted access to the site. Up to my left here, it will be guarded with a security guard, and he will be asking certain questions, and if you have an appointment and all this, you'll proceed to the next guard, and then so forth.
And that's up near
up near Eva Johnson's.
Mm-hmm.
And then the road right next to Rumors Cafe, that one will be closed down as well. And up by Rabaska's coming to the hospital, that's been closed down, and it's also for emergency services for the ambulance to come in to the hospital and deliveries.
Okay, so what happens once people come in and they're going to move in through this little area here in the little laneway? So what happens then?
Okay, so at that point, when they process, they go through every stage. The first security see if they have the appointment. They come to the second security and to re-ask that question again. If you have an appointment, if you don't, this is the road that you have to exit from. And the third is right at the test site, and the nurse will ask you, and it will confirm on their sheet that you have appointment, and if not, you'll back up and you'll take off again.
All right. Well, thank you very much, Ajeza. And of course, after that, you'll leave and just follow the signage. At this time, we'll be heading into the area where the actual testing is going to be happening, and we'll be speaking to Lloyd Phillips, as we have every day. We'll also be talking to Lisa Westaway, as we've been doing. And Lloyd, it's a Saturday, it's a beautiful day, but there's no rest, because it's you know, we get set for a pretty big, exciting day tomorrow.
Yeah, well, obviously the big news for today is the construction site here that's happening beside Kahnawake Hospital, setting up the testing facility, and all hands on deck over here, making sure that it's ready for tomorrow to start having tests happen right here in our community. Very positive development, you know, help people feel a little more at ease, and help us as well with a facility right here in our community. It gives us the ability to get a better picture of actually what is happening in our community. So that's going to be something we'll look at very closely over the next several days, and obviously, as usual, we'll keep you up to date. So as it's set now, the appointment desk has been opened. Lisa will speak to you on that a little bit regarding the numbers to call and such. You know, it's something that we feel is overall a positive thing in a very negative situation in which we're currently facing. One final point I want to speak about today is, obviously, as we keep telling you every episode, that we're monitoring what's happening in and around the province, and you may have heard, or you will hear, that various regions within the province of Quebec are going to be closed down to essential travel only. At this point, they're looking at the areas up north, the James Bay region, which is a very large region, Abitibi-Témiscamingue, and areas around the New Brunswick border. So those are things that the government is put into place, where they want as much as possible for people who live in certain regions to stay within that region and only have essential travel between those areas. We're monitoring that. I had several discussions today with Dwayne Zachary, the chief peacekeeper, and seeing how these things are playing out over a period of time. But right now, all the discussion that's happening is for the far north. So I just want to update you on that. We're monitoring the situation on a daily, constant basis, and with that, I'll see you again tomorrow.
All right, thank you very much, Lloyd. As we get to conclude this episode, we are on the site, and there's lots of work going on, so you may be hearing some of the noise. Lisa Westaway, of course, is the executive director of the Kahnawake Memorial Hospital Center, and she's here on a Saturday because there's lots of work to do, and some of that is going on right now. Where are we at, Lisa?
So we're just in the process of setting up all the tents. So I think they may have shown you how the cars are going to come through. There'll be some checkpoints for appointments, and then we'll also be registering you in one of the tents and then going into one of these two sides of the tents for testing. So I first want to say a really big thank you. This happening is an amazing collaboration from a really big group of people, all community members who have banded together to really make it possible, make it happen. We also have staff that are going to be coming to work, taking all of your appointments. There are people that are coming from all different parts of hospital functions and maybe even from other organizations. So it could be dental hygienists, it could be community health workers, it could be administrative support. They're all coming together to be able to make this happen. So a really big thank you, and I really have to also thank the CIS Montérégie West. They will be providing nurses. They provided a lot of logistics support and information, and that allows us also to make this happen. So thank you very much to them. So I just want to talk about a few things. I want to remind you that you have to make an appointment. So the number is the Kahnawake Memorial Hospital Center number, 6450-638-3930, and I have to look at the extensions because I always forget. So it's 2296 and 2275. You have to call and make an appointment. We already have some people scheduled for tomorrow. I'll tell you a little bit about the instructions. If you don't remember them all, you can look on the website. They are all over there and very clear. But just to remind you, if you are coming, first of all, you have to call, and somebody will assess you over the phone. It is not a nurse that is assessing you, so they won't be able to answer all of your questions that are unrelated to the test. They'll only be able to assess your symptoms in order to see if you fit the criteria for an appointment. So you must have symptoms. When you call, they will also, so they'll assess that, they'll give you an appointment, and then they'll tell you what time to come. When you come, if you are the only person that has symptoms from your household that is coming for a test, you must come by yourself. You don't want to have anybody who doesn't have symptoms in the car with you, because remember, we are social distancing and we don't want to make anybody else sick. So it's one person in the car. If you happen to be a family of 2 or 3 that are all being tested and you all have checked with the people who answered the phone and they've given you all an appointment, you can all come in the car together. A maximum of 4 people. You each have to be sitting at a window that rolls down and rolls back up. This is to ensure the safety and protection of the nurses who are going to be doing your test. So that is really important. You cannot walk onto the site and be tested. You will be asked to turn away. So we will have security here, we'll have the peacekeepers here. The important thing is just to ensure that everybody is safe. So that's why we have to have these measures in place, because we want to ensure that safety of all the staff so that we can continue to do this for really as long as we need to, actually. So some people have been asking a lot of questions. What happens if I don't drive, or if I'm not mobile and I'm at home and I can't get out? We're in the process of working that out. I hope to have more details for you this week. we haven't forgotten about you, and we know that it's really important that you get testing done too if it's required, and so we will have something implemented hopefully before the end of next week. So I'll come back to you with that information. Also, some things I've been hearing. So we've had some calls today, and we want to remind you, if you have symptoms, we've said this quite often, if you have symptoms, and it's okay, we need to keep repeating it, then you should be self-isolating. If you have symptoms and you're worried that you have COVID-19, you should separate yourself from your family. You should be in a different room. You should have your own bathroom if possible, and you should try as much as possible to isolate yourself from the rest of your family. So of course, if you're coming for a test, we're going to ask you also to self-isolate, because that's what we've been asking for a very long time. If you don't have symptoms and nobody in your house has symptoms, you won't be tested, and you'll be practicing social distancing, meaning you're trying as much as possible to stay as far away from more than 2 meters from people at all times. So again, if you're coming to take a test, it's because you think you may have COVID-19, meaning you may be in contact with someone, you may have traveled, and you have symptoms, and therefore you should be social isolating, so keeping yourself into one place. What I've heard today is that some people are actually saying they don't want to be tested because they don't want to self-isolate. So remember, that's not the whole point of this. The whole point is to for people who have symptoms and who are suspect cases, that we keep them away from people who are healthy. So we try to lessen doing a little work here, try to lessen the amount of transmission of the virus so that we can flatten that curve. So that's really, really important. The other thing that I want to mention is that we're all in this together. So it's not stigmatizing to come and get tested. It's actually really, really important. If you have, the more we know about what's happening in Kahnawake, the more we can make decisions and implement changes that will be for the better of the community as a whole, and the more we will save lives. So all of the charts that I've been looking at shows that as you increase the amount of testing, you decrease the amount of new cases. Why is that? Because people are more conscious. When you test, you contain, and then people stay in their homes more, and then the virus doesn't spread as much. So that's the whole goal of this. We want to test when we need to test, not when we don't need to test, because then we're wasting valuable protective equipment and testing materials and experts' time. So we want to test when we need to test. We want you to self-isolate when you need to self-isolate, and we want to be able to contain and save lives as much as we can, and that's the whole goal of putting this testing site together. So again, you have to call for an appointment, 638-3930. I have to look at the extension again because my memory's not that good. 2296 and 2275. 2296, 2275. Please call from 8:30 to 4:30. We have people who are here who are taking your calls and giving you appointments. We only have 8 people booked tomorrow. From all of the emails and questions I've received, I know that there are many other people who have been stating that they have symptoms and they're worried. It's important that you get tested. Your results are confidential. It's very important that you call in and take an appointment. Okay, so thank you, and we'll be open tomorrow morning. First appointment's at 2. Thanks.
All right, thank you, Lisa, and thank you, folks, for watching. We'll be back tomorrow, as we usually are, around this time. And again, take care of yourselves, take care of each other, and we'll all get through it. So that's it for today. Remember, it opens tomorrow officially at 2 p.m., but you can make your phone calls earlier than that, 2 till 4:30?
Yeah.
2 till 4:30 tomorrow afternoon.
No, and 8:30 to 4:30 for an appointment.
And 8:30 to 4:30 for your appointments as well. So that's it for us this time around. Thank you for watching, and be healthy, folks. Take care of yourselves.